I'm going to go ahead and start. Teresa, if you'd go to the next slide. Okay, so this is just a quick update. I just want to remind you, if you're not familiar with EBT Edge, it's an app that our bank provides. Um, and we don't typically promote it very much. However, it is the app that Snap and Cash use. And so if you have participants who are already on the Snap program and they have their Snap cards in the EBT Edge app, they may also have their WIC cards in there. And so we just like to share updates. Again, we don't really push it or promote it, but just so that you guys know what's going on if something were to come up or you got a question. I think they get a lot of this information from the SNAP program. But yeah, so this is really just a quick update, just a reminder of what the app is. So beginning on September 15th, EBT Edge is going to implement multi-factor authentication options. There will be 3 options. Their most secure option is going to be MFA by text message, which is where you just get a one-time code texted to your phone and you use that to log in. Their less secure option is to get that code via email. And then there is an option for no MFA, in which case they'll just answer a challenge question to log in. And they already do that. They already set up challenge questions when they set up their accounts. And so if they choose not to use multi-factor authentication, then it will just continue the same way they log in right now. And that's all for me. So I'm going to pass it over to the nutrition team for some Whisper updates.
The first one we have is going to be a review of the hemoglobin changes. There's nothing different than what is already in policy. We reviewed these changes in March of 2023, but we're kind of just wanted to do a quick little review of them again to kind of let you guys know that Whisper function has been fixed and it now meets policy. So that change that we did last time was we removed the 60-day requirement part from the hemoglobin screening part that was related to last time it said measurements had to be taken within the current participant category and could not be older than 60 days old. So we removed that age requirement. We still have that 60-day requirement. If someone forgets to bring the hemoglobin, they have 60 days from the cert date to provide some sort of data. But that's the same thing with ARPA. Nothing's changed with that. It's just we wanted to make sure Whisper is functioning how it should be and matching policy. And again, this was what we reviewed in March of 2023. So we're just kind of going over it to let you know that Whisper will now function this way. And the measurements, it may look a little different in Whisper when you're in there. If someone are noticing, well, I couldn't enter a data point in there and now they can. It's because if it's within that current participant category, they can use that data. So then the next part, there's still no changes of when we want to obtain the hemoglobins. So basically the hemoglobin testing is going to be collected for all participants. The exception, of course, is going to be infants under 9 months of age. We don't do that except on a case-by-case basis if they're a premature infant and the doctor can say, hey, we need to make sure we get a test done, and they can assess if they need that test done. So we could potentially do it for someone less than 9, but our standard per practice is going to be infants 9 to 12 months of age, and all the rest of the collection status here. So when someone who's pregnant, we want to make sure that they have their hemoglobin done at certification. If somebody was a breastfeeding woman and now they are a pregnant woman, you're going to have to get a new hemoglobin level because it's participant category. It's based on the participant's category, so it doesn't transfer from basically categories. So you're a P, you get a hemoglobin. You're a breastfeeding woman, you get a hemoglobin. And it can be obtained at whatever point within that certification period, as long as it's within that category, if that makes sense what I'm saying. Same thing with the children, so no changes. We still want to do them. We want to try and get their first one at 15 to 18 months of age, usually 6 months after the infant test. So no changes there. And then we do want to get a hemoglobin obtained yearly if within normal limits for children past 24 months of age. If, of course, If somebody has a low level, we're still going to want to check that again in 6 months. So there's nothing changing with policy on that and no changes on that. So that's just kind of the quick little reminder. Whisper's now going to function like the policy is. Any questions on that?
Teresa, I do have a clarification. So
Uh-huh.
the whisper changes will be in effect on October 1st of this year.
Thank you.
So, just so you guys are all aware, we're planning to push a new release to UAT on August 12th, and that release will be in prod on October 1st, and that will contain these changes that Teresa is referencing.
Thank you. And if you need me to send the PowerPoint presentation that we did originally in March, feel free to let me know. I can send it to you guys. Just let me know. If there's no questions, we'll move on to Kathy's portion.
Okay, great. Thank you. I'm discussing the letter of ineligibility, oftentimes called the term letter. Currently in Whisper, the top half of the form, it's not changing. It hasn't changed. It's looked this way for a long time. The bottom half of the form is, you can see it's got that signature box for participants to sign. And this one is dated August of 2023. But next slide. In October 1st, like Ambrelle was saying, when it goes into production in Whisper, the LOI will no longer, will have some changes. So the first box has changes that the email addresses have been added. They have changed the civil rights coordinator to the Office of Administrative Hearings, and they've you can see we removed that participant signature box. They've updated the link to the discrimination complaint form, and this newest version is June 2024. Next slide. So from our January 2024 training call, we did discuss letter of ineligibility just for a minute, and that's where we mentioned that participant signatures are no longer required. And I was just going to talk a little bit about LOIs. I believe that the local agencies have all been sent the paper copies of the new LOIs. So I think you guys already have those in office. If not, please correct me or reach out to state to ask if you need them. But overall, it's important that participants know if and when they will no longer receive WIC benefits. Every time an LOI is created, whether it's generated in Whisper or it's written out by staff on the paper copies, the first cardholder needs to be made aware of upcoming termination of benefits. And kind of think about how you word that when you're saying termination of benefits. There have been instances when the first card holder might interpret it to be that all of their WIC account is closing and they're going to stop getting benefits, but then they were just, in fact, staff was just giving the LOI for a sibling turning 5, and the other sibling was still eligible to receive benefits for a few years. So that was just one thing to think about. And then I think it's happened in every clinic where they received a call from a confused or upset participant asking why they didn't get any benefits for the month. And then when the staff researched it, they were like, oh, it's because that participant termed out, their certification ended. So it's the fact that Whisper allows the letter of ineligibility to be printed up to 4 months prior to that participant's insert date can make it kind of confusing. People can easily forget something they were told in an appointment 3 months earlier. So hopefully, if during that phone call the staff person says, oh, it's because they are no longer eligible to receive benefits, it might jog the participant's memory and they might say, oh, yeah, I was told that I was going to stop receiving benefits, or that child was going to. And so, one other little side note about that is that it is It's okay, Teresa, it doesn't matter. I just want to point out that when I say WIC benefits, I'm not just referring to WIC food packages. It's important to remember that benefits can also include breastfeeding help and support. Because we can have active Category B participants who don't receive a food package, but they are just eligible to receive benefits of breastfeeding help and support. And then this slide here just shows the update from the January 2024 training call that the signature line was removed. Next slide. It's important that we do have letters of ineligibility. If participants ever decide to file a discrimination complaint or to request a fair hearing, WIC does have to show that the participant received notice about the end of their benefits. And we accomplish this by having that LOI on file. And according to WIC policy in Chapter 4, Section E, the policy states that participants shall be advised that the certification is ending at least 15 days before the certification expires. And the notice must include information about why the participant is no longer eligible and the right to request a fair hearing. Next slide. So during any kind of appointment type, in person, remote, whatever, it's important that staff review and discuss the LOI with the first card holder, and they have to offer a copy of the LOI to the first card holder. So again, citing policy, it says review the letter of ineligibility with the applicant / first card holder and provide them with a copy. For remote appointments, review the letter of ineligibility and mail, email, or text a copy to the first card holder. File the letter in case a fair hearing is requested or a discrimination complaint is filed. So for documenting the letter of ineligibility, it's nice because in Whisper, a note is created in the participant summary staff notes that a letter of ineligibility was printed, and it provides the date and the reason. And so it's really nice when you print the LOI off of Whisper because there is documentation for that. Next slide. So as you may all know, Whisper doesn't always generate an LOI. And in instances where Whisper isn't generating that LOI, staff still need to follow policy by filling out a paper LOI and providing a copy to the first card holder. When paper copies are created, then Whisper obviously doesn't create a staff note about the LOI being completed. Excuse me. But as long as we have that LOI on file, it is considered adequate documentation. So again, Chapter 4, Section E says documentation, a copy of the letter of ineligibility, the application, if applicable, and other certification documentation must be kept on file, either electronically or hard copy, for 4 years. So just make sure that if you do end up creating a LOI on paper, that it is accessible on file for 4 years. Okay.
There was one question on LOI. I couldn't see it. If someone wants to read that out, I can't do it while I'm sharing.
Oh,
Yeah. Do we need to keep a printed copy, or does the generation of the LOI meet this requirement?
so yes, when you print that off of Whisper, you do need to keep a copy. And then whether it's electronic or hard copy, it does need to be on file at the clinic for up to 4 years.
My question really is, like, because we don't need a signature if a first card does not want a copy, we've offered that, they say, oh, I don't want a copy. I still need to print one out to either scan it back in or save as a PDF. Like, I'm a little bit confused by that. Like, if that is documented in Whisper, we still need another documentation by printing it out.
I guess, Shannon, I've never really even thought about it, that if it is documented there in Whisper, that that is good enough. Because, yeah, in the past, we did have a signature. And you know what? I'm going to have to get back to you because I honestly don't know the answer to that question. Um, but thank you. That is a really good question, actually, because you're right. Printing it, it used to just be to show the participant had signed it and that there was confirmation of understanding. So that is a great question, and I'll get back to you on that. I'm going to have to ask a couple people and do a little research on that. So, are there any other questions that you might have about the LOI or anyone? Okay, let's go on to the next topic that I was going to discuss, and it is the no linked infant. And this update to Whisper is changing the freeform text box for the no linked infant to a drop down. And when the other option is selected for no linked infant, then it opens a text box and staff can document the reason for no linked infant. Now, just to give a little bit of more information about the no linked infant, if you go to the next slide, this just shows what it's going to look like with the drop-down reasons: foster care, adoption, out-of-state infant, non-gestational parent, and temporary separation. And then if you do choose other as the reason, like I said, it does open a text box and it does allow you to choose or to type the reason. So on the next slide, I'm referring you to a document that is available in the in Whisper, and it's called Whisper Reasons Guidance, and it has topics like voiding unused and future benefits, no proration, no linked infant, special auths, deactivating WIC cards, and terminating certifications. This is a really good document to have on hand, and it's referenced quite a bit. But specifically to talk about the no linked infant, the no linked infant checkbox is an option when a woman is category B and the infant receiving the milk is a WIC participant, but not in the same family as the category B participant. So it's a little confusing, but it is possible. And some of the reasons for that are, like an example, foster care or adoption. That could be when a participant's birth child is placed in foster care or given up for adoption, and the category B participant is still providing breast milk to that infant. One thing to remember that's important is that staff must verify the infant is still a WIC participant in another family. There could be a scenario where there's an out-of-state WIC infant, as rare as it could be, but we've made an allowance for that. The woman in Idaho can still be breastfeeding and providing milk for that infant across to a different state, and staff might have to call and verify that the infant is actually participating as an active WIC participant in the other state. Another example for non-gestational parent is the one providing breast milk. The infant is on the birth parent's WIC account. Whisper won't allow you to have like 2 active women participants receiving benefits. So the non-gestational parent who's providing the breast milk would have their own account in this scenario, and the infant would be on the birth parent's, the gestational parent's account. And so this is just outlining that the birth parent would be category N, would receive a food package for 6 months, but the gestational parent the non-gestational parent who is providing breast milk to the infant would be eligible for a food package depending on how long they breastfeed and the percentage of breastfeeding. And then there's also allowance for temporary separation, like an infant's been separated from mom and placed in a different WIC family just temporarily, but she continues to provide breast milk. That still, she qualifies as a category B. All right. That is all I had about the no linked infant change that is going to start on October 1st. Does anyone have any questions about that one? Okay, well, thank you very much.
All right, I think that Leah is up to talk about the DHW's new wildly important goal, or the WIG.
So I don't know how many of you have heard of a WIG before. I know this was brand new to me. It's apparently from Stephen Covey, the gentleman that wrote 7 Habits of Highly Effective People. He also wrote another book about a wildly important goal. And so some of you may know this already, but we do have a new director here at DHW, and his name is Alex Adams. He's super passionate about child welfare. He's actually a pharmacist that received his master's in public health at Johns Hopkins University. And so it's kind of neat because he was able to study under Dr. David Page, who is kind of known to be the founder of WIC. So because of that, he has some additional knowledge about WIC and passion about WIC that some of our other directors previously, or just some other people in that position, might not be as familiar with. So that's good for us. And he very much wants to support our efforts to increase participation. When he heard that we were only serving 44% of eligible participants, he said, well, we need to get that up to 80%. And I know that's a really ambitious goal, but it was neat to hear him passionate about it and interested in supporting WIC. So when the director first started, he made it clear that he had one wildly important goal, that he wanted our whole department, and our whole department's about 3,000 employees. And so he wanted our whole department to focus on this one wildly important goal, which we'll discuss soon here. So when you hear about a WIG, that's what we're referring to, is that wildly important goal. All right, so on this slide, the new goal, that new wildly important goal, was added to the department's strategic plan, and it was actually posted as the #1 goal for our department. So it's to improve child welfare outcomes, specifically focusing on foster care children. So I'm going to read the bullets to you. Our actions are in the best interest of children. We safely decrease the number of children entering the foster care system. We provide improved support for foster families. We support family preservation, and we promote adoption opportunities. So as you read through these, as I read through them, hopefully you guys can identify that WIC contributes to all of these bullets in varying ways. So WIC provides families with additional resources and support that help keep families together. WIC participation has been shown to decrease the likelihood of having child welfare issues, such as children being moved to foster care. So WIC is an important part of, when you first glance at the wildly important goal about focusing on the child welfare system and foster care, you don't automatically say, oh, WIC is contributing to this, but WIC definitely contributes to keeping those families together so that there are fewer foster children in the system. All right, next slide. The first bullet on the left-hand side of this slide shows you what our actual WIG is. So the actual WIG is to double the rate of qualified resource families, and a resource family is just another name for a foster family, in 24 months, from 0.7 homes per child to 1.5 homes per child in July, by July 2026. So some of you may be aware of this because I know it's been in the papers a lot, is that we definitely have a problem here in Idaho, and many other states have it as well, of there just being too many foster care children and not enough resources. So currently, as you can see, we only have 0.75 homes for each foster child, which isn't sufficient. It has resulted in foster children staying in hotels, staying in places that are not homes that foster children should not be in. So that's why the director has identified this as his wildly important goal in order to really focus all of our attention on, or a bunch of our, not all, because we have our own programs that we run too, but to focus a lot of attention on this so that we can make a difference for this, for these foster children that are in our community. So this goal can be accomplished in two ways. So one of them is by increasing the number of foster care families. And then the second way is by decreasing the number of foster care children that enter the system. So that's where WIC comes in. Next slide. So like I mentioned, the Department of Health and Welfare, they set up that wildly important goal, which we just talked about on the last slide. But then each division is also supposed to identify their own wildly important goal, or WIG, to support the department's WIG. So the Department of Health is broken up into 9 different divisions, and WIC is part of the Division of Health, of Public Health. Public Health has identified increasing participation in WIC and the home visiting program as their measures for how they will contribute to the overall WIG. So the Division of Public Health has 8 bureaus that are creating their own WIG. So I know it gets a little confusing. We've got the department WIG. Under that, we've got the division WIG, which that's where the WIC specific WIG lies. And then under that, each bureau is supposed to come up with their own WIG. So like I said, the Division of Public Health has 8 bureaus that are creating their own WIGs to support WIC and home visiting. It's been really exciting to have so many staff and programs interested in learning more about WIC and promoting it within their programs and with the audiences that they serve. So one example is the Bureau of Vital Records is planning to include WIC outreach information in every birth certificate mailing that they do. So that means that every new mom in Idaho will receive information about WIC. So a lot of this is stuff that we've really wanted, stuff that we have really pushed for. And so it's nice that we now have all this additional support in order to provide additional resources. And another example is working with Medicaid. So Umbrell has been working really hard with Medicaid to do a Medicaid matching project in order to get a list of participants that are, or people that are participating in Medicaid but are not participating in WIC. So that project has moved forward much quicker than it had in the past, and much less red tape for us, because WIC is an important part of meeting the department's WIG. So more information on that to come later. All right. So this right here shows you the divisions specific. So this is just a little bit more detail. The last slide was more general, and this is just a little more detail about what specifically the division's WIG is. So if you see down in the lag measure here, the second bullet, that one is the one that is specific to WIC. And our average participation so far, so this number is from 2023 because we had a full fiscal year of 2023. But if you're looking so far in 2024, our participation's actually at 31,000 right now, or the average, because participation has been increasing overall in our state. So I don't think we're going to have any trouble meeting the goal that has been set for us, and I'm sure we will exceed it with all the additional support that we have by 2026. So we're working closely with the division. So I wanted to point out that lead measure down there. And we are working closely with our division's PIO to create WIC outreach toolkit that can be used by other bureaus to promote WIC. You can see that the goal, the lead measure there is pretty ambitious to target a unique audience weekly, but it just shows how committed the division is to the WIG and to supporting the WIC program and the home visiting program. All right, so the last slide that I want to share is the WIG that is specific for our bureau, which WIC is in. So remember, once again, we've got the division WIG, then under that, or sorry, we have the department WIG, then under that we have the division WIG, and then under that we have the bureau WIG. So WIC is part of the Bureau of Clinical and Preventive Services. And you guys, most of you or many of you know Christy Litzinger, and she is the bureau chief of our bureau. So obviously she's very familiar with WICs, and she used to have my position. So our bureau's WIG is focused on increasing the number of referrals from WIC to home visiting. And that includes parents as teachers and nurse-family partnerships. So the home visiting program, they're planning on presenting at the September NEAT call. So I want to encourage all the local agency WIC coordinators and any supervisors to attend that call to learn more about the home visiting program and how we can better track our referrals in Whisper. So the one thing that I do want to note, it's my little disclaimer here, is that the division and the department WIG, that one is solid and approved. The division and the bureau WIGs are still just proposed WIGs. They've not been fully approved, but we do anticipate that they will be approved any day. And so that's why I feel confident sharing them with you early. So I know that was a lot of information, but I really just wanted to share with you guys what's going on at the in the department and in the division, since so much of it affects you guys. So I want to open it up to any questions. All right, well, if any questions do come up, feel free to email me anytime or call me, and we can talk through it. One thing that I do want to say is I did notice that there are a few WIC, local agency WIC coordinators, which are not on this call, which is totally fine. This is not a mandatory call for you all. But I did want to just ensure that whoever is representing, if your local agency coordinator is not on this call, please share this, make sure to share this information with them. And Umbrella always has a recording, so they can just watch this part of the call. Thanks.
Right. Thanks, Leah.